Hey, welcome everyone, and welcome to those of you joining us online as well. Today, Dr. Susan Kamundia is going to present to us, and Susan is a postdoc in the African Centre of Excellence for Inequality Research, which is based at the Southern Africa Leibbrandt Development Research Unit. Susan holds a PhD in economics from the University of Cape Town, where her thesis focused on maternal healthcare utilization. She has also evaluated the free maternal healthcare program in Kenya and how this has translated into maternal and child health outcomes. Her current research interests also include the measurement of multidimensional poverty and inequality, as well as gender gaps in labor force participation. Over to you.
Thank you. Hello, everyone, and thank you so much for making the time for this presentation. So this is a paper that we are working on with Professor Leibbrandt, who's the director of ACEIR, and we're looking at measuring multidimensional poverty in Kenya across time and space. Okay. So this is just the outline of the presentation. So we start by looking at how the poverty situation looks like in Kenya. And then we interrogate the global MPI framework. So I should mention here that the purpose of the paper is not just about the global MPI because it's been used over and over again. We actually have some papers within SALDRU that have used the framework, and it's also used worldwide by entities, including the United Nations, to track a few SDG goals. So the purpose of the paper is actually to look at how well does the global MPI framework actually fit a specific country context, in this case, Kenya. So we want to look at how to think about things if you want to use the global MPI framework in a specific country context. Then we'll look at the methodology, results, and end with a conclusion.
Online people, I just click that.
Hello, Hajira. Okay, so we have the Sustainable Development Goals, which were adopted by UN members in 2015, and Kenya ratified and adopted the SDGs in 2016. So the first SDG goal looks at eradicating extreme poverty, and one of the targets being that by 2030, they should have halved the poverty in these countries. But as per a report by Sachs et al. In 2023, the reduction of poverty in Kenya is not proceeding at a rate at which we can actually achieve the halving of poverty in Kenya by the year 2030. And if we look at the latest Kenya poverty report, which was produced by the Kenya National Bureau of Statistics in 2023, we see that individual poverty headcount is at approximately 38.6%. And if we may look at how the poverty rates have evolved since 2015, we can see that, so between 2015 and 2019, we had a slight decline. But in 2020, of course, we had an increase due to COVID. And on top of that, we also had a locust infestation in Kenya, which ended up also affecting the food security of households and individuals. So that's why we have a peak in 2020. But as of 2021, the poverty has reduced a bit, but as you can see, the reductions in poverty are not that much. Then, sorry, I should have mentioned this. So the poverty rates on my right, so they're calculated using the consumption per adult equivalent. So it's different for the urban and rural areas, since it is cheaper to live in the rural areas compared to the urban areas. And then you can see the rural areas consistently have higher poverty rates compared to the urban areas. And the same applies to the severe poverty. The rural areas always have a higher average compared to the national average, while the urban areas have a lower average compared to the national averages. But the other aspect of poverty that cannot be ignored is the spatial differences in poverty. So as much as we have the 38.6% poverty for Kenya, there are some areas in Kenya which are highly disadvantaged in terms of poverty compared to others. So if you look at the map, we can see that towards the north and the northeast, we have very high poverty rates. So these are areas which are classified mostly as arid and semi-arid lands. And so you find that their livelihood mostly comes from pastoralism and the like. And then in the middle here, that's where we have the capital city. So for the areas around the capital city, we have relatively low poverty rates compared to the rest of the country. So I'd like you to keep that image in mind because it will come up in a later slide somewhere. So of course, the consumption per adult equivalent is a money metric. What it doesn't tell us is, as a result of this lack of income, what deprivations actually come with that lack of income. So we have asset-based poverty measures, and we have the deprivation-based poverty measures, which fill this gap. So asset-based poverty measures just look at the assets that are owned by an individual household, and then you can calculate the distribution of assets for that. And then for the deprivation-based measures, you are looking at, if you have a set of indicators, what is the individual deprived on? And then you can actually determine who is more deprived and who is less deprived. So the global MPI is a deprivation-based measure. And as of 2024, it was actually, they actually released their briefings for the countries last week, and they were calculating the global MPI for 112 countries, which include high income, middle income, and low income countries. So since I say that we're going to be assessing the fitness of the model to Kenya, we are using two data sets, one from 2014, one from 2022, from the Kenya DHS. And so the samples as given, they comprise approximately 96% of the total sample collected in those two surveys. So what does the global MPI framework look like? So they look at 3 dimensions of health, education, and living standards. And then within the dimensions, you have the indicators for which you want to see whether the individual is deprived or not. So for this case, an individual is deprived if the household or anyone in the household is deprived of any of those indicators. So we have 2 indicators for health, 2 for education, and 6 for the living standards dimension. So as much as the multidimensional poverty index is more on the SDG 1, using the indicators, you can also track how the other SDGs are actually looking like. So from SDG 2, 3, 4, 6, 7, and 11. So how do you calculate the poverty index from this? So they have equal weighting of indicators. So you assign weights to the indicators, but you first start by assigning weights to the dimensions. So they do equal weighting of dimensions. So for each of the dimensions, you assign a weight of a third. And then within the dimensions, you also assign equal weights. So for the first two dimensions, the indicator weights always tend to be higher because you have a third divided by 2, as opposed to the last dimension where you have a third divided by 6. So the indicators in the first two dimensions will have a weight of 1/6. The indicators in the last dimension will have a weight of 1/18. So for you to calculate the multidimensional poverty index, so you assign, so if someone is deprived, they get a score of 1. If they're not deprived, they get a score of 0. So what this would look like would be, so you have this function here where you have the weights and you have whether the person, so G is whether the person is deprived or not. And then when you sum up that, you get a deprivation score. So a deprivation score, so basically it should range from 0 to 1 because the weights are fractions. So the deprivation score is between 0 and 1. And then for the global MPI, so you have a distribution between 0 and 1, and you want to see who is actually considered to be poor. So the global MPI assigns a poverty line at a third of the weighted indicators, which means if anyone is above that poverty line, which is this one, they are assigned a value of 1, 1 being that they are considered poor, 0 otherwise. So the point is, you'll have whatever number of deprivations the person has, once they are weighted, and you assign the poverty line, poverty cutoff, then you determine who is poor and who is non-poor. Then from that, you can calculate the headcount ratio. So Q is these people who are assigned 1 here as a proportion of the total. So it's just Q over N. Then one of the inclusions in the multidimensional poverty index is the poverty intensity. So you are just not interested, you are interested in those who are poor, and you also want to know for the ones who are poor, how poor are they? So that's why we have the poverty intensity, which is basically a summation of the deprivations of the poor divided by the number of poor individuals. When you multiply the two, you get the multidimensional poverty index. So in some literature, it's also referred to as the adjusted headcount ratio, because it's the headcount ratio adjusted by the poverty intensity. So it allows you to see who is poor and how poor are the poor. So having presented that, so what do we want to do with our paper? So for the indicators I showed in the figure, we want to see in the Kenyan context, how reliable are the indicators? For the weights that are usually assigned, how valid are the weights in the Kenyan context? And the poverty line of a third, is it actually appropriate for the Kenyan context or not? And then once we do that, then we can check the evolution of poverty across. So here we say before and after the adoption of the SDGs, because 2014 was just immediately before, and the 2022 was, well, it's the last DHS we have. And then after that, we'll also look at the spatial temporal distribution of poverty in Kenya. So to start with the reliability. So when you're checking reliability, you want to see how much of the variance in the measure you are trying to construct, in this case, the poverty index, how much of the variance is actually explained by the indicators you include in the calculation of the index. So the McDonald's omega, it has a threshold of 0.8. So if you get a McDonald's omega of 0.8, it means 80% of the variance in the construct you're trying to measure, in this case, poverty, is actually stemming from the indicators you have included in your model. So it's more of an iterative steps kind of thing. So we start with the global MPI specification, and we test for the overall model specification. And as we can see, for both surveys, the threshold is not met. So we figure that it is possible that we need more indicators to get our model to the threshold. So we include additional indicators for schooling gaps. So schooling gap being you're in school, but you're more than 2 years behind from where you're expected to be at your age. Then overcrowding being if you have more than 3 people sleeping in the past sleeping room. Financial inclusion, whether the person has a bank account or not. And we expand the child attendance indicator to include children of school-going age, being that the global MPI does not, it only includes children of primary school-going age. So these indicators are borrowed from the multidimensional poverty index that is specified for Latin American countries. So they have these additional indicators, and some of the indicators that they have included in their model, we could not add because our data set does not have them. So we have those particular indicators. And then we redo the assessment, and we see that as much as the McDonald's omega has increased, it still has not reached the threshold that we need it to be at. So what could be the problem here? It is possible that even after we have added these indicators, so the statistic depends on the indicators you have put in, which means one or more of the indicators might be the reason why we are not getting to the threshold, because the individual indicators are not reliable. So we move from the overall model, and then we go to the indicator reliability. So indicator reliability means 2 things. One, since we are measuring poverty, the indicator should be able to discriminate well between who is poor and who is not poor. So which means that if you have an indicator which anyone across your deprivation distribution has, then it does not discriminate well between the poor and the non-poor. And then secondly, a sufficient number of individuals should be deprived. The point being that if an indicator is only, the proportion of people who are deprived is very small, then it's no longer actually bringing out poverty. And if everyone or almost everyone has the indicator, then it's no longer measuring poverty either. So to do that, we use a 2-parameter item response theory to test the reliability of the individual indicators. So the 2-parameter IRC, it helps us find out how well the indicator is discriminating between the poor and the non-poor, and whether a sufficient number of individuals are deprived. So if you check just from the graph, you can see that almost all the indicators included, they are behaving the same except one. Now, when you look at so for you to determine whether an indicator discriminates well, you look at the steepness of so the item response curve, sorry, I should have started from here. The item response curve shows you how well, so if you're increasing your latent poverty, because up to now we're saying we still don't know the measure here, so it's latent poverty. So how does the probability of being deprived change with an increase in latent poverty? So it should be that small increases in latent poverty lead to large increases in the probability of being deprived. So we can see for most of the indicators, they behave well, except the child mortality indicator in both the 2014 and the 2022 surveys. And to be more specific, we look at the statistics. So for an indicator to be considered reliable, the discrimination statistic should be at least 0.4, and the difficulty statistic should be between negative and positive 3. And when we look at the, so if we look at the, for both surveys, it's only the child mortality indicator that does not meet that particular threshold. So from this, we can actually conclude that the child mortality indicator is not a reliable measure of poverty. So for the rest of the analysis we do, we drop the child mortality indicator. So as much as it is included in the global MPI, we drop it for the rest of the analysis done in this paper. And when we recalculate the McDonald omega after we drop it, then we see that the omega actually goes, it's actually above the threshold required for the overall model to be considered reliable. So once you've looked at the reliability of the model and the reliability of the indicators, we also look at, so remember, for the global MPI, we have equal weighting between dimensions, equal weighting within the dimensions. So we want to see whether that is the best model, okay, rather that is the best weighting for our data set, or if we need to use a different weighting. So to achieve that, we use confirmatory factor analysis. So confirmatory factor analysis is where you have this model. In our case, we have the framework we've actually come up with, and you want to see how well is it fitting to what we already know. So this is different from, so we also have exploratory factor analysis where you assume that you don't know how the indicators are related, and you are choosing to actually determine the relationship between the indicators. But for our case, we use the confirmatory factor analysis. So this analysis gives you two statistics. So the CFI and the TLI, they are goodness of fit models, no, goodness of fit statistics. So you're comparing your model against a baseline model that has no correlation between the indicators. So it means that it has to be different from 0. And the accepted threshold for that is 0.9. Then the root mean square error of approximation, you're comparing your model to a perfectly predicted model, which means the difference between your model and the perfectly predicted model should actually be very small. So the accepted threshold for that is 0.06. So we start from a point where we have our unidimensional specification. So unidimensional meaning that it is possible that the dimensions are not necessarily the same. No, they're not necessarily important. So you can basically estimate a unidimensional model. So when I say MPI weight, I mean equal weighting between dimensions, equal weighting between indicators. And then the equal weights, it means that we're assuming absolutely no weighting system to it. So basically everything is weighted as one, but it is within a multi-dimensional specification. So if we start from the unidimensional specification, it actually meets the thresholds we require for the three statistics. But since we are using multidimensional models, we want to see whether actually the multidimensional models are better than that, or we should just stick to the unidimensional specification. So when you look at the equal weighting, you can see that the statistics don't meet the thresholds required, but the equal weighting one actually meets the threshold, and it's very similar to the unidimensional specification. And then since we had, because remember we dropped the child mortality indicator, when we drop it, we can see the MPI weighted multidimensional specification is still below the threshold. The equal weighting still meets the threshold. So from this, we'll use, so since the equal weights and the unidimensional are not too different, we will stick with this one, simply because at some point we end up comparing the global and the global MPI to what we are using. But if we were to use the unidimensional specification, it will still be fine. But for purposes of comparison, we stick with the expanded MPI specification. Sorry, it should be this one. The expanded MPI specification without the child mortality indicator with equal weights. So having done all that, what is the deprivation distribution look like? So remember that the deprivation score is calculated as the weight multiplied by whether the person is deprived or not. But since our weight here is 1, so basically the deprivation distribution, it just depends on whether the person is deprived or not. So we are not multiplying by, okay, we are basically multiplying by 1. So for the 2014, we can see the distribution here, and the 2022 is above it. And so we can say that in 2022, the individuals are actually less deprived compared to 2014, because it's a deprivation distribution. Since you want more people on this side, the fact that we have successive increases at each number of deprivations, then it means in 2022, people are doing better compared to 2014. So from this, we can tell how well are the people doing, but we still need to determine who is actually considered to be poor. So remember, for the global MPI, the poverty line is at 1/3 of the weighted indicators. But so the argument against that is that, so like for the global MPI, you have high income countries, you have low income countries. So if you put the poverty line at 1/3, you mean that the multidimensional poverty realities in the countries is the same, which in most, okay, actually it does not. Because, for example, in a high income country, if you're deprived of any of the indicators, you might actually be considered poor. But in a low income country, you actually have to be deprived of a number of indicators before you're classified as being poor. So for our case, we use this framework by, Babonnet, Simona Musa, and Suter for 2016, where they set the poverty line using a Poisson distribution framework. So you have your observed distribution. So the observed distribution is the proportion of people who are deprived of whatever number of indicators. So that is the blue line. And then, so for the Poisson and the negative binomial distribution, you predict a distribution given the mean number of deprivations that you have. So for our case, the mean was approximately 5.9, and So it depends on the mean and the variance. So the variance is 7 points. Yeah, it's approximately 7 point something. The point being, so for you to predict a Poisson, you're assuming equality between the mean and the variance. For you to predict the negative binomial, you're assuming that the mean and so the variance is more than the mean. But so ideally, I should have just left this one, but I predicted both just to show that regardless of which distribution we use, we actually end up with the same conclusion. So according to this framework, someone is considered, so the poverty line is actually set at the point at which what is observed in the distribution exceeds what is predicted. So from this point, so we have a cross here, but in the middle here, the observed is higher than is lower than the predicted. But at this point and this point, that is, so for this point, that is where your observed exceeds the predicted for the negative binomial. And here is where the observed distribution exceeds the predicted Poisson distribution. So if you look at both, so if you look at this point, you would say that given the thresholds required, the poverty line is at greater than 6. Since we have equal weights, it means greater than 6 means 7. Then for Poisson, if you can see, it's almost exactly at 7. So regardless of the distribution used, we still end up with a poverty line at 7. So why we insist on the poverty cutoff? If we had applied the global MPI framework, where the poverty line is set at a third, our poverty line would be here at 4, which means the people between 4 and 7, which in our framework are not poor, under the global MPI, if we use the global MPI weights, they would actually be considered poor when they are not poor. And if you look at the distribution, you can see that's practically where the bulk of the individuals are actually. So between 4 and 7, that's where the bulk of the population is stationed. So the point of this exercise basically is like for you to set the poverty line, compare like with like, rather than setting a global poverty cutoff that sets both high income and low income people at the same scale. Sorry, Aiden.
So what determines whether the subcomponent is deprived?
Deprived or poor?
Like on this graph, it's saying like a number of definitions. So how are you determining whether like subcomponent is being deprived?
So the poverty line is set at the point where the observed distribution exceeds the predicted distribution. In our case, it's greater than 6 for the negative binomial distribution and almost exactly at 7 for the Poisson distribution. Using both, you actually have a poverty line of 7. You okay with that? But for the global MPI, they just set it at a third of the weighted deprivations. Since we have 12, a third would be 4, which means would be here. If we just use the poverty line as it is, like a third of the deprivations. We are good? Okay. So having done all that, we move to the results. But I need to point out though, that all the statistics we have presented, whether it's for reliability, validity, and the poverty line, they all depend on the indicators you have used. So if any of the indicators were to be dropped or changed, then it would definitely change those statistics, right? So from now on, we are comparing what is in the global MPI, which they usually release country briefs every year, against what we are calculating in our model. So it's just an exercise to see, given that we have changed a lot of the components and the weighting, how does it affect the statistics we get? So comparing the statistics for the global MPI framework against the validated. So basically the validated framework gives higher statistics for everything. And one of the reasons we think, especially with regard to the child mortality indicator, because remember, a very small proportion of people were deprived in this particular indicator. And given it has a very high weight, it means that it brings the poverty statistics down. So that is just one of the lines of thinking we are, okay, sorry. That's one of the lines of thinking as to why we are getting very high statistics compared to the global MPI. But that aside, we can see that for the head count and so M naught is the multidimensional poverty index. So for both the frameworks, the poverty statistics are lower for 2022 compared to 2014. But so H is the head count, M naught is the multidimensional poverty index, A is the poverty intensity. So for H and M, both of them are going down, but for the intensity of poverty for both frameworks, it's more or less the same. And what that means is that as much as the number of the poor people are reducing, the deprivations experienced by the poor is actually relatively constant across the two time dimensions that we are looking at. So one of the beauties of the MPI is that you can decompose it across indicators, you can decompose it across regions, subgroups, and the like. So here we are doing an indicator decomposition. So we are comparing, so the blue dots are what are in the global MPI framework, and I would say red, that is what we have in our particular framework. I need to point out though that we are not comparing like with like, because even the number of indicators is different. But so there's a point we want to make with this one. So if you look at, so for the global MPI, you have 10 indicators. For our framework, we have 12. So it is 10 minus the one we drop plus 3 others. So the thinking would be that the indicator contributions to the MPI should actually go down for all the indicators in question. And if we look, so for the indicators, so for, okay, if it's just appearing once, so this one is only in the validated framework. This one is the one we dropped from the global framework. So it will only appear once. But for the other indicators, okay, as much as the contribution is not exactly the same, it pretty much tracks. But when you come here, you have these huge differences. And for the nutrition indicator, we actually have a very big difference. So under the global MPI framework, the nutritional indicator is actually the biggest contributor to the MPI. But under our framework, it's like the third smallest contributor to the MPI. And why would this be so? It's because, so basically, under the global MPI, it had one of the highest weights, which is 1/6. Under our framework, basically it is weighted the same with all the other indicators. So we have this huge discrepancy between what we have in the global MPI and what we have under the validated framework, just to make a point that the weighting of the indicators is actually important for this kind of analysis, because you find that you might actually get a very high, and I think even for the South African context, the nutritional indicator is one of the highest. But how do you know it's actually because people are most deprived in that indicator, or is it because of the weight assigned to that particular indicator? So this is just it's just a decomposition across rural, urban. So basically the story remains the same. We have reductions in the H and the M, but the poverty intensity remains more or less the same. However, for these particular frameworks, the difference between the poverty intensity between the rural and urban is not too different. But for the head counts between rural and urban is very different. The MPI, the difference between the rural and urban, is actually quite huge, but the poverty intensity is not so different. So what could be driving these differences in between the rural and urban? So basically, here you have 0. As you move away, it means a higher proportion of people are deprived. So we can see that, so the blue is the rural for both. And for 2014 and 2022, for all the indicators, the people in the rural areas are more deprived compared to those in the urban areas. It's only the overcrowding indicator, which seems to be almost the same for the rural and urban. But for all the indicators, the rural populace is actually disadvantaged. Another point I'd like to make, so here, so if you look at school attendance, here and here, so we're actually doing quite well with the years of education and school attendance, but the schooling gap is quite, you actually have a huge proportion of individuals who are more than 2 years behind their age-specific, the expected age-specific grade which they should be in. So we can say from the global MPI, we would see that the education dimension is actually one of the smallest contributors to the MPI. But here we can see as much as we're doing well, we still have issues with the schooling gap. And then we look at the spatial decomposition of poverty. So as at the time we were doing this paper, Oxford had not released their results. So yeah, we thought we had a very nice point to make about the differences between using large spatial units to decompose poverty versus using smaller units. But since they updated their MPI last week, I'm only going to make that point for the 2014 results. So if you compare, so actually to bring back the figure I had shown before about the money metric poverty. So basically, we still have almost the same thing because on the northeast, we have the highest poverty. Here in the middle, we have the least poverty. But if we compare the 2014 figures, so I should mention, these are provinces, these are counties. So since 2013, when you go to a devolved government, we use counties as so counties are the second level of administration. But the counties were created from districts, so you can actually compare what is happening here and there. So the story here in the middle, it's the same. You have very small multidimensional poverty. For this particular province, you can say the story is the same. But the importance of having smaller spatial units comes when you are considering provinces like, this one is Eastern Province, and this one is Rift Valley Province. So when you come here, you find that you have a lot of heterogeneities in terms of the poverty experienced across the provinces. So of course, we're saying that this is better. Since you have a smaller spatial units, you can actually see what is happening at a lower administrative level. But of course, now even Oxford has updated their analysis to the counties, and we can see that the picture is pretty much the same for the global and the validated frameworks. So I've been speaking for a while, so what have I been saying? So one, the importance of actually looking at the reliability of the indicators used in poverty measurement. So we saw that the global MPI model on its own is not the most reliable. We added other indicators. And then we see that the child mortality indicator is not reliable, so we drop it. And then we have equal weighting as being the best model for the data sets that we have. And then the point about the poverty line. So if we set the poverty line at 4 being a third of 12, right? So we would have the people who are deprived of 4, 5, or 6 indicators being classified as poor, and they basically may constitute at least 34% of the samples used. But now with our validated framework, the individuals deprived of 4, 5, or 6 indicators are considered to be non-poor. And then lastly, we see that poverty has reduced from the overall perspective, from the subgroup perspective, but the deprivations of the poor still remain quite high. So that speaks to what exactly, because for the MPI to reduce, one of the components has to reduce. So in our case, we see it's the headcount that is reducing, not the poverty intensity. So the poor remain as poor as they were in 2014. And of course, if you want to chat, yeah, those are the social media websites and the like. Thank you.
Yeah, maybe I just wasn't paying attention, but can you explain again? You're talking about reliability and explain variance, but what's the outcome variable that you're explaining? Is it poverty income? You've got these indicators, and you want to say they're indicators of what?
Multidimensional poverty.
Of what?
Multidimensional poverty?
No. You need some observable that you're predicting based on these indicators.
But at the point at which you are looking at reliability, we are assuming we have not calculated the multidimensional poverty index. So that's why we are saying it's latent poverty. We have not measured it yet, but this combination of indicators, do they actually measure the same latent construct?
Yeah, I guess I don't understand. I mean, I think if you got a latent construct, you've got some observable variable that you're trying to predict. And I don't see what the observable variable is here.
So the observables are the indicators we're using to measure the latent construct, in this case, poverty.
Okay. Fine.
Thanks, Susan. I like, it's very interesting to see like how the weights. I've always like, I haven't looked at this multidimensional poverty stuff. I was aware of it like a while ago, and I was always like, how do these weights, where do they come from? And it's cool to see like the validation. So that was very nice to see. Am I right in understanding that it's like a relative measure because you're using that Poisson and against the observed distribution, like you're gonna have, you can't compare these across countries, I assume, right? Yeah. And then that gives you that granularity within a country instead of everybody just being poor in Kenya. So I was wondering, what is the conceptual reason for only doing that observed versus predicted distribution at the national level, rather than like also saying, okay, now we're also going to see because it seems like the very big differences between rural and urban poverty. And so right now you've got you can like see the urban areas and the rural areas, it seems, from the map. But if you did that validation separately just for rural areas, would you see interesting patterns in those rural areas as well, that some are poorer and some are richer? Or is that just not something you can really do with the method, or wouldn't be valuable? I was just wondering about doing the national calibration like you've done, but also doing separately by urban and rural to see patterns within those regions.
So for the poverty line, if I were to introduce the rural urban and I end up with different poverty lines, then basically I'm comparing two different things. So when you're putting the same poverty lines, like you're putting everything at the same scale, and you want to see who is doing better than the other, given this scale that you're put, which is the same for whichever subgroup you want to decompose along.
Right, and so that makes a lot of, and it's very useful for the comparison between urban and rural, like you were doing. But I was just wondering if it would also be interesting to look at within rural.
What would be the poverty line?
Exactly, and then so there's some rural areas to other rural areas, or some urban areas to other urban areas in more detail than you get when you're combining it. But I mean, it's not necessary. I was just interested. Yeah.
Okay, that's something to think about. Thank you, George.
It's David Gordon from the University of Bristol in the UK. Thank you very much for your excellent talk. I was interested in your use of Poisson and negative binomial to try and find the optimal cut point for the optimal poverty line. Under a number of circumstances, it can give a too high a cut point, and I put it in the Q&A a link to a paper which would suggest that maybe using a univariate mixture model may give you a slightly better result. I just wondered if you thought that might be a useful approach.
Thank you, Dave. So I remember from the summer school we had in 2022, some other measures were put across. So I guess I'll have to look at which among the Poisson, the latent, the FMM, the finite mixture models, and the latent construct analysis, I'll have to check whether they give me the same result or whether, as you say, I'll look at the paper and see whether there's an advantage to using the Poisson or otherwise the LCA or the FMM.
Thanks. That was a really interesting paper. Thanks.
Thank you, David.
Yeah, great. Thank you. And it's so wonderful to have Dave Gordon on the call, because to some extent you motivated all of this, Dave. So ACEIR's had the privilege of working with Dave Gordon for a number of years now, and he's taught us a lot. And so Dave could certainly answer Harold's question about the underlying latent variable that you're trying to measure. And to some extent, this the tradition that Dave comes out of is one of interrogating your indicators and your dimensions very, very carefully before you're using them as your sort of almost your responsibility. If you want to do multidimensional measurement, then you've got to do it properly. And to some extent, this paper gets caught. Well, not caught. It uses the tools that Dave's taught us about, but to interrogate within the framework, if you like, of the Alkire-Foster Global Multidimensional Poverty Indicator, which is not Dave's preferred landing point, but it seemed to us incredibly important to do because of the weight that's given to these global MPI indicators in the UN statistics and in an assessment of SDG progress, etc., under the guise of international comparability. There's all of this sort of standardization that can't possibly fit in in all country contexts, and so we wrote this paper to have a first look at Kenya. And we're thinking that this is a very promising line of research, actually, for ACEIR to take to our core countries, but working closely with Dave so that we do absolutely the best possible work, and then maybe other African countries too, because it's, you know, it's fine to insist that you need to do international comparability, but what if you're then going to use it to evaluate countries' SDG performance? Well, you know, what is your, you know, don't you want to get that evaluation right for that country? Anyway, that's my comment. I'm delighted Dave's on the call, because I was going to make a little statement about these two worlds that we've been inhabiting in terms of multidimensional measurement in ACEIR. Thank you.
Sorry, thanks so much. It was super interesting to see. Yeah, it was really interesting to me to see, like what Murray was just saying, that you're really focusing on here on statistical properties of the indicators and the weights rather than normative properties, which is generally, I guess, what the global MPI has been driven on, you know. The only thing then which I saw little justification, and obviously I'm sure it's because of time, is the indicators you added was clearly a normative decision. Everything else is pretty much statistical and to try to find the optimal, you know, cutoffs, weights, etc. But then there was this normative kind of throwing in of a few variables, which obviously is very, you know, as you yourself said, kind of then has implications on certainly the levels you get. So I was wondering, DHS obviously has a whole scope of variables. Is there any way you can do kind of some, I don't know, robustness checks to see, you know, if you throw in other indicators, to do almost statistical exercise, if you put in other indicators that normatively seem sensible as well, you know, how would the kind of, what would the variance in your outcome look like, you know?
So the indicators which are included, they're actually drawn from a different MPI specification. So the MPI is basically an Oxford Poverty and Human Development Initiative thing, but they also have a version where it is only done for the MPI. It's MPI Latin America. So I borrowed from them, and
you know how they chose?
No, but but that's why the reliability test actually comes after I've included the indicators. So it kind of, since it actually works for the Kenyan context, so I leave it.
I guess it was more just like, are there other indicators you're missing that are super important in the Kenyan context that haven't been included just because they weren't included in the LAC MPI? And how would your measure change if you put in others that conceptually you think in the Kenyan context would be super important? It's nothing to do with the criticism, it's more just like.
Actually, they had more indicators, but since my data sets don't have them, I cannot put them in. So like employment, they have indicators of social protection and the like, but my data set doesn't have those. And where they exist, they have too many missing values. So yeah, I did not include those.
There was a question online first before Aidan's hand, but I see it's been lowered. So Anthony?
Yes, it's Anthony. And thank you, Susan, for a great presentation. I was just wondering whether it would be possible to push this a little bit back to 2008. I am assuming that you've used the DHS.
Yes.
Would that be possible, perhaps? And then we get a longer term view? Thank you.
So yeah, for the MPI, it can be calculated across the surveys. But we figured since it was more about an assessment of the framework rather than the MPI itself, that's why we only included 2 periods. Because if you include other surveys like from 2003, actually, Oxford has already done that, and they show us that poverty is actually reducing. So yeah, So it was more of what's the contribution you are making here, because Oxford is doing the other, they have been doing the other DHSs so far.
Okay,
Yes.
great.
Thank you.
Hello, is it working? I just want to follow on from the question from 2 questions ago, about including more indicators. And I know you said there was not necessarily data available for more indicators, but I think when creating an index, with like a lot of indicators, my question is, say you've got 2 indicators in that set, which are highly correlated. Now, if you're giving them equal weights, it's like you giving more weight to a certain indicator, which represents a certain underlying concept. So I think it's just a rhetorical question or an open-ended question. Like, would you think of like trying to change the weights rather than them being equally weighted, in terms of like correlation between the indicators?
So do you mean like different from, because it was more of comparing what we already have, and then what if we don't make any assumptions about the weights? So do you mean like from a statistical point of view where you use factor loadings and the like? Okay, I'll have to get more clarification from you on that. Yes.
Well, I was going to say that the input about the sort of arbitrariness of adding the 3 variables is completely accurate. I think that's not unfair. It wasn't completely arbitrary. We did take it from a Latin American literature, but obviously if consistent to our framework is actually thinking very, very carefully about the relevant set of indicators, as we have done in our derivation of indices of vulnerability to COVID and vulnerability to climate change. So, and it similarly goes to the point that's just been made by Aidan, in that you do interrogate the cluster of indicators that you're using to represent a dimension. It's not just arbitrary, or it shouldn't just be. And I guess that's part of the research program. We were trying to find some indicators that we could show demonstrably improve the multidimensional measurement of poverty in Kenya over what's used globally, and try and show that that's quite consequential in actually how you think about what's happened in Kenya. That's all that we've done. Thanks.
Thanks, Murray. And I think a great way to end. Thank you so much, Susan, for sharing your work. And we'll see you next week.